Hi, my name is Elena Nazareno and my topic is triple CFTR modulator therapy for the cystic fibrosis. Definition: cystic fibrosis transmembrane contains regulator CFTR modulator therapy are designed to correct the malfunction protein made with the CFTR gene.
People are born with, and it causes over time people to have lung destruction, recurrent infections and inflammation. The reason that happens is because there's a genetic disorder that causes a mutation in the protein, and the protein actually doesn't make it to the cell surface where it's supposed to function as a chloride channel. So the current treatment for cystic fibrosis is really based on symptoms. So we treat people's chronic infections, the thick mucus in their lungs with things like pomazyme, hypertonic saline, chronic inhaled antibiotics. In addition to the thick mucus that people have in their lungs, they also have thick mucus in their pancreas. So their pancreas doesn't function properly. And we also have to have people therefore take enzymes every day with every meal and every snack in order for them to absorb their calories. So those are the basic treatments that we use in addition to airway clearance to move the mucus out, and exercise work quite well. Again, there was an improvement of around 13%. Again, in these patients, you saw additional improvement above TESI level around 9 to 10%. They've used in the past, where they may not actually notice whether or not they've started it. With these drugs, they notice right away when they start the treatment.
Nursing application. The nursing care process is responsible through different methods for identifying the real and potential problems present by patients suffering from this disease in order to achieve recovery.
Hi, my name is Deborah Boyer, and I'm one of the pediatric pulmonary doctors here at the Children's Hospital Boston. Today I'm here to talk to you about cystic fibrosis. Cystic fibrosis is a genetic disease that causes the cells in your child's body to have difficulty handling the movement of sodium and chloride. This ultimately ends in the production of some thick, sticky mucus, and it's this thick, sticky mucus that leads to the side effects that we see when children come to our clinic. So the organ most commonly affected in cystic fibrosis would be the lungs. And if you take a closer look at the lungs here, a cross-sectional area, you're going to see what are called the bronchi, or the airways of the lung. And if you take a look at one of these normal airways depicted here, what you're going to see would be a muscular layer and then a big tube where the air passes through. This tube has a thin layer of mucus in a patient who does not have cystic fibrosis. When you look at the airway of a patient with CF, as depicted here, you're going to see some infection or bacterial growth in that airway, and that bacterial growth is going to lead to this thick section of mucus that obviously is going to make it a lot harder for air to flow easily through that airway. Another major concern that we have in children with cystic fibrosis would be their growth. And the reason for this is that about 90% of patients with cystic fibrosis have what we call pancreatic insufficiency. What this means is that the pancreas, located here, is unable to secrete the proper enzymes into the small intestines, right here. This then means that your small intestines can't absorb the right nutrients. Because cystic fibrosis is a lifelong disease, it's critical that you develop a strong relationship with the clinician and the team that's going to help take care of your child. Here at Children's Hospital Boston, we do this every day, and we're very comfortable taking care of your child from the school-age years through the difficult adolescent years, and then as they transition into an adult cystic fibrosis program. So you can be assured that we'll be there for you every step of the way along that process.
Pros and cons. Combination of correctors and enhancer CFTR have demonstrated a clinical benefit in the growth of patients. Cons. The opposite of this treatment is that it is not effective for all people who suffer from this disease and are still being studied.
Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any would bind to the CFTR protein. Then, for each small molecule that had some binding ability, researchers chemically synthesized different variations of that molecule and tested them for the ability to improve the function of some types of mutant CFTR channels. They identified a drug that, when taken by patients with a certain type of CFTR mutation, binds to the CFTR protein, opening the channel and allowing improved ion transfer. This increases chloride ion flow and maintains a watery, clear mucus, which helps the cilia move more freely and reduces the risk of bacterial infection.
Application in Ecuador. This vein treatment under study that has improved the life of a group of people. It is still in a study phase. It is still in the study phase. Therefore, there is no record of its use in Ecuador.
Of age is really an acceptable standard, even with that progress. And the good news about the aspirostat program is we're actually addressing a component of treatment for cystic fibrosis, which is currently a huge unmet medical need. That's in tuning down an overheated immune response with administration of a drug like aspirostat. And while that standard of care has risen over the last couple of years, I certainly say it's a good thing to wake up in the morning and think we can do more for these patients. And that's what Celtaxis is focused on, enhancing the standard of care for patients with CF, and we're delighted to be engaging with regulators to design that Phase 3 program. Celtaxis just completed the largest Phase 2 research program ever completed in cystic fibrosis research history. And I'm very pleased to say we saw some very important outcomes and very consistent signals in aspiristat's ability to reduce pulmonary exacerbations for patients with cystic fibrosis. Unfortunately, even with the best standard of care today, patients are likely to
Conclusion. CFTR modulator for the treatment of cystic fibrosis are growing and that is quickly changing. If we capture the first CFTR potentiator to reside if the approval has however been will tolerate and produce dramatic result in CF patent with a G55 ID mutation. Thank you.